Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I am perinatal mental health certified, and I am maternal newborn nursing certified. Non-stress tests are often ordered at the end of pregnancy, and they can sound very scary. Today we'll be explaining everything you need to know about a non-stress test and what to expect. So click those like and subscribe buttons and stay with us. So you are probably asking yourself, why did my doctor order this test anyway? So there's many reasons why you might need a non-stress test. It could be because you're past your due date. Maybe you're a high-risk pregnancy. Maybe you have like diabetes or high blood pressure. If you report that your baby is not moving the way the baby should, they'll order a non-stress test. Additionally, if you have some issues with your baby, like a baby that's small for gestational age, if you're having more than one baby, like twins or triplets, or if you have an Rh negative blood type, these are all reasons why your pregnancy may be high risk and you might need a non-stress test. I'm sure you must be thinking, is something wrong? So not necessarily. Again, non-stress tests are ordered for a lot of different things. We're basically just trying to check if your baby is reactive or non-reactive. A reactive baby is a good sign. This is a sign of a healthy baby. A non-reactive strip means that the heart rate is not changing or your baby is not moving much. This is why we might give you something to drink. Now, a non-reactive strip could mean that there is an issue with your placenta or an issue with the baby's umbilical cord. It can also be a sign of fetal distress, so your doctor may order additional testing. Is a non-stress test safe? That's your number one question. Yes, there is absolutely no risk to you and your baby. You don't have to prepare, you don't have to take medication. There's nothing really you have to do other than sit in a recliner chair and relax. This test can only be done after 28 weeks of pregnancy, but it's super easy for you. Please remember to hit the like and subscribe buttons so you can get our latest content. So, what does a non-stress test even look like? First, they're going to have you come in and either lie on an examination bed or in a recliner. A lot of times they have recliners. The whole test should take about 20 minutes. They're going to put ultrasound gel on your belly and then they're going to put 2 monitors there. The cool thing about a non-stress test is you get to listen to your baby's heart rate. That's one of the monitors. The other monitor is there to measure if you're having contractions. The whole test is recorded on a piece of paper, and you may be asked to click a little button if you feel the baby move. Finally, if your baby isn't moving the way we expect the baby to be moving, or if the heart rate isn't quite what we want to see, you may be asked to drink a sugary drink and the test may be repeated for another 20 minutes. Additionally, we sometimes also use a buzzer, which is a little device that kind of sends a buzzing sound to the baby to kind of wake baby up. So the test results weren't good. What's going to happen now? Does this mean you're automatically going to be giving birth, having a C-section? No, not necessarily. Like I said before, we're going to start by letting the test go longer, giving you some sugary drink or maybe doing the buzzer to see if we can wake baby up. Sometimes baby's just asleep. Next, if the baby still isn't looking great, we're going to do something called a biophysical profile, which is an ultrasound to check your baby. We might also do what's called a contraction stress test. This is a test to see how your baby's heart rate reacts when you are having contractions. And finally, we might put you in the hospital for additional monitoring. It's very rare that if you have a non-stress test that's not good, that we're immediately going to jump to C-section. Does everyone have one of these, or are you all alone? So no, not everyone will have a non-stress test. However, some people will have more than one during the same pregnancy. You might even have more than one in a week. It just depends on how your baby looks. And see, the thing is, sometimes a non-stress test will go from non-reactive to reactive. This can be because the baby's sleepy or the position of the baby. So we don't want to just jump to emergency measures. Instead, we may want to repeat this test. And you know, the most important thing is make sure that you are comfortable. Bring something to read, bring something to do. You know, just try to take your mind off of it and not be stressed. I hope this video has helped you learn what a non-stress test is and what to expect. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe buttons so you can get our latest content in pregnancy, labor and delivery, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.